This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindu's In Focus podcast. I'm Zubaida Hamid, your host for today. The national capital was rocked by student protests last month after three IAS aspirants tragically drowned when the basement library of their coaching center flooded following torrential rains. While a police case has been registered and arrests have been made, the students have pointed out that safety norms are routinely violated at coaching centers and the stormwater drains in the area were clogged, leading to the water inundation. Just this week, a woman and her 3-year-old son drowned in a drain in Delhi again following heavy rains. India has a massive problem that is not often acknowledged or recognized enough: preventable drowning deaths. As per the National Crime Records Bureau's statistics for 2022, over 38,000 people died in India due to drowning, a little over 9% of all deaths. Apart from deaths due to flooding, there are also multiple deaths due to accidental falls into water bodies, boats or other vessels capsizing, or due to getting washed away in rivers while doing basic household work such as fetching water, washing clothes, or bathing. So, what is the scenario with regard to drowning in India? Are we doing enough to prevent drowning deaths? What did India's framework on drowning prevention released last December say? And how will climate change have an impact upon drowning deaths? We delve into these questions and more with Lopa Ghosh, Senior Communications Advisor at Global Health Advocacy Incubator. Welcome to the Hindus in Focus podcast, Lopa.
Thank you, Zubaida. It's a pleasure to be here talking to you.
Lopa, could you talk to us about the problem of drowning in India? Last week, we saw that three IAS aspirants tragically lost their lives after the basement they were studying in got flooded. Where and how do drowning deaths occur? Who is most affected? And what are the primary causes of drowning here in India?
So, drowning is certainly a significant public health crisis. I mean, drownings have always happened, people have always drowned. But it's just that the way we are looking at drowning in recent years, we are taking a more holistic view, a systemic view of drowning, why drowning deaths are happening. And if you've seen the recent data published by the NCRB, the National Crime Records Bureau, we know in their report, Accidental Deaths and Suicides in India, we know that about 38,000 people die every year. Now, it's important also not just to look at the total toll that we have at the moment, but to also consider that the fact that globally as well as in India, drowning is one of the leading causes of unintentional injury, death. And the burden of that is extremely high. So it's basically in India, for instance, it is probably the second leading cause of death after road accidents. Now, there is a high burden, as I've already said, and in a country like India with its vast coastline, so many rivers, basically ubiquity of water bodies, where about 80 to 85% of people actually live in very close proximity to water and also rely on water bodies for their daily activities like washing and bathing or even their livelihoods. Naturally, their interface with such daily interface with water, the likelihood or the risk factors of drowning will always be high. But the other reality is also there that which makes the Indian situation unique is that we also have a dense urban population. So all of the risk factors are, applicable for the urban context, such as rising sea levels, inundation of, low-lying areas of the city, urban floods, a drainage system that can no longer cope with the population, or even constructions and freak weather events, as we saw last week. All of that are contributing, and we do not have the wherewithals, or I mean, we are not prepared to cope with this perfect storm, as it were. So someone drowns around the world every other minute. It is indeed the third leading cause of deaths, unintentional injury deaths. While anyone can drown, and there are many ways in which one can drown, the fact also remains that 91% of these drowning deaths occur in low and middle income countries. And, in fact, no drowning is the same. And we must also consider the fact that it's not just open waters or risk taking behavior, they are not the only reasons why drowning may happen. More than 90% of drowning deaths, in fact, occur in rivers, lakes, wells, domestic water storage vessels. Like, people, little children particularly, can drown in uh, buckets of water when left unsupervised. So the demography or the causality of drowning is a pattern that we've studied in recent years, and there will always be country specific, regional, local, or even cultural variations. But having said that, the most vulnerable groups are without doubt, and this is really an unfortunate and grim reality, that children and adolescents are disproportionately at risk of drowning, and they account for more than half of drowning deaths in the world. In India as well, children 1 to 4 and 5 to 9 and adolescents are at high risk of drowning. Uh, and there are a number of reasons why this happens, but we can sort of go into that later on. We also must recognize the fact that men are twice as likely to drown than females, and that's true in India as well. Gender norms are at play in this case, because men are more likely to participate in outdoor activities. They are more likely to undertake risky behavior, alcohol consumption, or for that matter, seek recreational activities. Apart from that, we also have to acknowledge that vulnerable social groups, as in all health related issues, are the ones that are most at risk. So, ethnic minorities, regardless of the economic development of the country that they reside in fact, are more likely to drown, or people impacted by humanitarian crisis. So, all of these these groups of people are most at risk of drowning.
Thank you, Lupa. Would you say that many of these deaths are preventable?
All drowning deaths are preventable, and that really is the reason why we must take urgent action. Every single drowning death is preventable. So unless we, in fact, in the WHO recommended, strategy, or the 10 actions that WHO recommends, it is all about prevention. And these preventions are, while it requires a convergent approach, these are low cost interventions, and these are very uh, even though we do need a national framework and we do need a direction in place, a strategy in place, because so many, it's a multi-sectoral approach that we need to take. It is also a fact that these interventions must be effective for the community that is at risk. So it should be very highly localized and community specific. So, to answer your question, that drowning is one such. So, for instance, we talk about the epidemiological shift that has happened worldwide, and we see that more and more people are dying of non-communicable diseases. Um, so, in this new epidemiological order of how people are falling sick and dying, it is a preventive paradigm, as we call it. Uh, it is, of course, curing the disease and treatment is also important, but equally important is the prevention of it. And drowning, even though people have drowned always, it is just that with our newer understanding of how it occurs, prevention is absolutely vital. That is the one thing that we must do in order to respond to drowning deaths adequately.
Let's get into the community specific interventions you talked about a little later. Could you talk to us about something you mentioned earlier? Now, you said the NCRB said that there are 38,000 people who die annually. This amounts to about what, 9.1 or 9.3% of the all of the deaths that occur in India. Would you say that our statistics, our figures need improvement? Are we getting a real picture of the number of deaths here?
So let me start with how we are looking at data globally. In order to understand the problem or the real scale of drowning deaths, data is critically important, as it is with other health issues as well. But the specific problem with drowning, and this is true of the global toll that we are talking about from WHO as well, which is basically 250,000 people dying every year of drowning, even that is a major underestimation. And we recognize that. We know that the estimated death toll is all the more alarming because it does not adequately represent the full scale of the problem. And there are a number of reasons why this happens. Before I get into the reasons, I just want to say that it is because of this specific nature of problem with counting drowning deaths that we feel that the Indian numbers will also improve once the government has already talked about better data collection. Once the government triangulates all of the data that is coming to it from different sources, once it has gone out into the community and done, household level surveys, that it will eventually better understand what is the true extent of the problem in India. The reason is that, the way drowning deaths are categorized is slightly problematic. So, for instance, we exclude, I mean, so far, intentional drowning deaths like suicide or homicide, murders are excluded from the death toll. Even drowning deaths caused by floods and other natural disasters are often excluded. Water transport incidents may be excluded. So if there is, a boat capsizing, then that may not be included in the way the drowning data is counted. So, for instance, in India, the NCRB data for drowning is looking at accidental deaths, right? Accidental fall into the water, unintentional deaths, injury deaths. But it is looking a different bucket, the way deaths due to natural events. So for instance, natural disasters as in floods, hurricanes and typhoons and other things, that is being looked at as a different bucket altogether. So it is important to marry all of that information. It is important to collate all of that information, and only then we will be able to understand the true extent of drowning that is happening. Plus, there are other issues because drowning is quick and silent, and often it is very very solitary and remote. So, for instance, the way communities approach reporting on drowning deaths, a lot of people in remote areas may be hesitant to go to the sort of to report drowning death as as they ought to. So that information is also somewhere we are probably not capturing all of that information as well.
So, in December 2023, India brought out the Strategic Framework for Drowning Prevention. Talk to us a little bit about this. Does this give a nationwide sort of a policy towards helping preventing drowning deaths?
Absolutely. I mean, this is, it's not a policy yet, Zubeda. It is just a framework. But I would say it is certainly a step in the right direction. Because one of the things that I just wanted to call to your attention is the fact that there is a lot of global momentum, right? We are doing a lot of work. A lot of countries are putting together drowning prevention plans, and even the public health community, the UN, WHO, they are prioritizing drowning. But these are early days because it was only in 2014 that WHO published the first ever global report on drowning. And then it was as recent as 2021 when at the UN a resolution was adopted on prioritizing drowning. And then subsequently, of course, the World Health Assembly took it up, and there was a call to action to all member countries to adopt national water safety plans. Now, the strategic framework for drowning prevention that was introduced by the Ministry of Health last year, it is really step one of putting together a plan. It lays out the priorities. It sort of says that we are emphasizing the importance of promoting water safety, and it is our intent to mitigate deaths by drowning. And there are also some other aspects that the framework prioritizes, and it's quite heartening to see that it already talks about convergence or multi-sectoral collaboration, because that is going to be absolutely critical. It also talks about the fact that just as there will be a national drowning prevention plan, there should also be state level action plans, because every state, every Indian state, the reality of drowning is going to be different. So, for instance, in Tamil Nadu is going to be vulnerable in a different way as Madhya Pradesh is going to be. So, Madhya Pradesh, in fact, according to NCRB data, it is one of the states with the highest burden of drowning deaths. But the way it is going to solve its problem has to be very different from the way maybe Tamil Nadu or Goa will solve, or West Bengal will solve their problems. Having said that, the importance of having a national framework or a plan is critical, because there are only those few recommended actions that are low cost and can be immediately set into motion. So it helps in having a clarity of thought, it helps in setting a standard, it helps even in framing a certain protocol. So these are the few best practices that are available as interventions. These need to be tailored to the local context. So that's the role that a framework plays. And eventually, when a policy is in place, or maybe different laws are put in place, and different regulations, different action plans are put in place, the reason why it's important is that we also need a certain budget allocation for it, for all to design all of these interventions. We also need a very robust monitoring and evaluation framework. We also need preparedness of the state. So, for instance, where are the resources going to come from in terms of human resources? People will have to be trained and put on the job to ensure that these plans are implemented. But this is certainly step one of the way forward. And we welcome the framework. I mean, the public health community is very optimistic about the framework, and we feel that in the coming months we should certainly. I mean, we hope that the government will take action, quick action, and put together an implementation path as well.
Going back to something that you mentioned earlier, Lopa, about the number of people in India who live in close proximity to a water body and also use it for their daily needs. How much does lack of sanitation, for instance, lack of access to piped water, play a role in drowning deaths because of women, children, and others having to, get water from ponds and rivers for bathing, for cooking, and for other domestic purposes?
So, there is a saying that anyone can drown anywhere. And there's a reason why that slogan was coined, because it is just a common understanding that people drown in open waters. That is, we've seen from experience from different country contexts how that does not represent the entirety of the risk factor. Drowning is it's an issue of social equity and access. So naturally, sanitation, availability of piped water plays an important role, as do gender norms. So we recognize the fact that women are the carriers of water. They are the ones engaging in household chores, all of which require them to access water. And oftentimes, when water is not easily accessible, they walk far out, maybe to fetch water. They may be trying to access wells where the water level has really dropped, or they may be trying to we know of incidents where women have slipped into the water while washing clothes in a pond. Now, therefore, sanitation, water access, all of that uh, aggravates risk of women drowning, women and young girls specifically. Actually, there is a very big gender dimension at play here. I mean, the way men drown, as I mentioned earlier, it's in open waters, pursuing risky livelihoods. But for women, how they're accessing water for their daily needs is a big aspect of uh, defining how women drown.
Um, Now let's talk a little bit about the measures that you talked about. The WHO, you said, has listed 10 measures. How far are we along in terms of implementing these? What are the small but critical measures that can be taken in the country to prevent drowning?
See, as such, an integrated plan is, it is still in the pipeline. And I'm guessing that once the now that the framework is in place, there will be a more orchestrated multi-sectoral intervention. But at the moment, I think a lot is being done, or at least there have been sporadic, sort of safeguard actions that have been taken by different states. So, for instance, and it has been very, I think, location and state specific. So, for instance, recently, the district magistrates of Goa they banned swimming in water bodies like waterfalls, rivers, lakes, abandoned ditches that fill up with water as part of their monsoon preparedness. So this is a very time specific, because this ban I think was only for 2 months. This is a very time specific intervention, but something that may be very relevant for Goa. Similarly, few I think recently Kerala government talked about, issued a circular that uh, swimming should be made part of the uh, school curriculum, and that is a very sustainable and long term view of things, because we've seen in other countries also how swimming lessons have played a major role in preventing drowning deaths. Then we also know of, for instance, the Ministry of Environment and Forest. They have often stepped in and built, the barricaded water bodies. Having said that, of course, I don't think there is any systemic approach yet towards rolling out and implementing all of the WHO recommended low cost interventions that I was talking about earlier. It's also important to note that it's not easy for a country like India to roll that out, and it will be time consuming. But given the fact that lives are being lost every day, maybe location specific, city specific, state specific interventions are basically the order of the day and should be implemented right away.
So, barricading of water bodies, you said. I've also read that, for instance, safe spaces for children can create a difference because often when their parents are working or are busy, then the children tend to perhaps accidentally fall into a water body. Having these creches or Anganwadi centers, does that make a difference?
That makes a huge difference. And in Bangladesh, in fact, it's really a best practice, you could say, the way it saved lives in Bangladesh. So, few years ago, when in fact it was a Bloomberg Philanthropies funded initiative in Bangladesh, where they wanted to study drowning deaths in children, because in Bangladesh it is the leading cause of death in young children. And they found that in the morning hours, when both parents are at work, and we know for a fact, and that's true in India as well, that in low income settings, and it's not just about the woman belonging to the workforce, but also about the fact that due to income pressures, due to poverty, both parents are having to go out to work, or the mother is very busy in household chores, and the child, because they cannot always have access to childcare. They may not have an extended family. The child is left to play unsupervised. And in Bangladesh, it was noted that from 9 in the morning to about 1 p.m., till afternoon, that most of the drowning deaths were happening. So, what they did, they sort of, and they felt that the solution was going to be very simple, just to put up safe spaces for children, supervised by adult childcare centers, and they called it the Anchal. So they rolled that model out, and ensured that when the mother was busy, when the father was away at work, and both of them were not available to attend to children, children were put in these creches. And just the simple act of ensuring that there is supervision started reducing drowning deaths. So, because in Bangladesh, 80% of drowning cases among children under 5 happened within 20 meters of the family home. Because if you know we know how riverine Bangladesh is, and how water is really a part of their lives in every which way. So, children were literally drowning in the backyard of their homes. So this is an absolutely critical initiative, and something that even a country like India should prioritize.
Last question before we sign off, Lopa. Um, how much is climate change and climate crises going to play a factor in this? Because as we've seen, torrential, unseasonal rains are happening more and more, and of course, right now landslides in Wayanad in Kerala. How much of this is going to have an impact on drowning deaths, and what should this also be a part of the plan?
Absolutely, Zubeda. And this is a very big challenge for us because there is no easy solution to climate change, and it really has to be a global response. So, prevention of drowning deaths, and of course, in the 10 actions that WHO has recommended, uh, climate change is not part of those easy solutions. It has to be a long-term approach and a more systemic approach. But we know that as weather related disasters increase, water related disasters are in fact going to be the most dominant form. And there has been a study that saw that floods accounted for almost like 41% of disasters that have happened in the last maybe 2 or 3 years. 70% of deaths that happen when floods occur are due to drowning. Therefore, the link is very clear that just as we head into uncertain times as far as the climate crisis is concerned, more and more drownings are going to happen because drownings are closely linked to intensified floods, tropical cyclones, tsunamis, rising sea levels, where people are forced to migrate for shelter, safety, and security. So all of that of displacement is happening, but we have to recognize that apart from all of the displacement and the adaptation that we feel should happen, we also have to look at drowning as a very important fallout of climate change.
Thank you so much for speaking to us today, Lopa.
Thank you, Zubeda. It was a pleasure.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.